Okay, other test that we are performing is erythrocyte sedimentation rate. Okay, this is not a specific test of our, I mean, maybe a traditional test that we are performing, okay? The rate of erythrocyte sedimentation depends on the number and the size of the erythrocyte particle, plasma factors, and certain technical and mechanical factors, okay? The most important factor determining the rate of fall of the red blood cells is the size of the falling particles. Okay, the more the size increase, okay, the rate increase. Okay, the size of the falling particles depends on the formation of the red blood cells Rolex. Okay, the clumping, okay, and then falling down. And I'm going to show you, okay, as you see here, okay, an indicator of the inflammation. Okay, it is not specific, however, it is an indicator of the inflammation. Now we are going to, okay, these are erythrocyte sedimentation pipettes. Okay, you are going to okay, take a whole blood into these tubes and standing them, okay, and stay for 1 hour, okay, and then you are going to give a result millimeters per hour, okay. As you see, it's changed the rate of erythrocyte sedimentation rate is changed by the age and genders. Okay. Okay. In the older, we have higher sedimentation rate. Okay. The red blood cells indices, which are calculated automatically, okay, by instruments, but we can also calculate them manually. Okay, as you see here, mean corpuscular volume, okay, is the average volume of the red blood cells in femtoliter as calculated with this equation. Okay, it's tell us some things about the volume of the red blood cells. Okay, the size of the red blood cells. Okay, whether is increase or decrease. Okay, it has different meanings in order to differentiate anemia. Okay, also to determine the causes of anemias. I'm going to show you. This is reference range for MCV. Okay, if increases, okay, then we call okay, microcytosis. Okay, if decreases is called microcytosis. I'm going to show you. Okay, now the mean corpuscular hemoglobin is the content of hemoglobin in average red blood cells. Okay, you are able to calculate a content of hemoglobin each single red blood cells. Okay, and you see also the reference range for that. And here we have mean corpuscular hemoglobin concentration is the average hemoglobin concentration in given volume of packed red blood cells. okay, as a calculated with this equation, okay. This is mean corpuscular hemoglobin, mean corpuscular volume of the erythrocytes, okay, divided by them and then multiply by 100. And you see the reference age, okay. We are fortunate these all calculation done by instruments automatically. However, as a laboratory scientist, we have to know these equations. But I'm not gonna ask you the equation, okay? No worry about that. Okay, the red cell distribution width is a measurement of the degree of uh, isocytosis. What that means, I'm going to explain them just in a few minutes. And you see the equation for that. It also has a meanings uh, when it's changed. Okay, no. Let's have some other questions for you guys. Okay, the anticoagulants of choice for a CBC. Okay, there are a few anticoagulants that we are using, but uh, the most common one, okay, the anticoagulant of choice for CBC is one more, please. Okay. Okay, the first one is the correct answer. Okay. Ethylene diamide triacetic acid, ADTA, is the uh, most common one. Okay. The anticoagulant of choice for CBC. Okay. Next one. Okay, which of following hematologic tests may not be a part of usual complete blood count, CBC? Remember, I told you these are included in CBC. Okay, hematocrit, hemoglobin, platelet estimate, metamyelocyte count, and none of above. Okay. The number of the erythrocytes, the number of the white blood cells, the number of the reticulocytes, right, are included in CBC. Now, let's see. Okay, D is the correct one. Okay, metamyelocytes doesn't seen in peripheral blood in that circulation. Okay. Okay, which of the following is a non-specific screening test for inflammation? We are giving the result as a millimeter per hour for this test. Okay. Erythrocyte sedimentation rate is the correct answer. Okay, is a traditional common laboratory test in hematology departments, but a non-specific screening test for inflammation. Okay. Okay, volume or size of the average red blood cells is known as which of the following? No worry, volume, okay, and you see the V only in one option, right? Okay, mean corpuscular volume, okay, indicate the volume of the red blood cells. Okay, one more. The morphologic appearance of the red blood cell in acute blood loss in trauma, I didn't share with you, but now I'm asking. Okay, no idea? Okay, I am going to skip them. Okay, let's see. Normochromic, normocytic is the correct answer, but I'm going to discuss this, okay, just in a few minutes. What that means. Okay, now it is time to talk about blood, the peripheral blood film. Okay, we are going to examine a drop of blood under a microscope. Okay, and then see its color, its shape, okay, its size, okay, and the shape of the nucleus, and so on. Now, the fresh blood from a finger or heel puncture can be used for morphologic examination of white and red blood cells. Okay? If you have a anticoagulant whole blood, you can also use such a sample, but you don't uh, uh, to wait for a long time. Okay, you have to use a sample, anticoagulant samples as soon as possible. Okay, let's say within 2 hours. Okay, what are going to examine? Once you take a look under microscope, okay, as you see here, you have to um, examine both white blood cells and erythrocytes. I already shared with you examination of the white blood cells. Okay, now we are going to focus on examination of the erythrocytes. Okay, okay, for erythrocytes, you have to consider a characteristics of erythrocytes as follow, as we see here. the variation in color or staining reaction, okay, variation in size, variation in shape, variation in structure and inclusions, okay, artifacts and abnormal distribution patterns. Okay, these all, each of them has sometimes really important meanings. Okay, you can let's say diagnose lead poisoning only to examine erythrocytes under microscope. Okay, and presence of nucleotides and nucleated red cells. Okay, normally there is no nucleated red cells, right? However, if you see, is abnormal. Okay, it tells us some things. Now let's get step by step. Okay, first we have to consider vari variation in color and staining reactions. Okay, you are going to stain the peripheral blood film. Okay, and then see uh, the variation in color and staining reactions. Okay, now normochromic erythrocytes, as you see in these pictures here above, okay, uh, you have a central pallor, right? Here, pallor. This is a normal staining of the red blood cells. Okay, you will become expertise by the time. Okay, and hypochromic erythrocytes means that they doesn't color enough. Okay, they as you see here. Okay, uh, and variation in staining color uh, is known polychromatophilia. Okay, polychromosia refers to red blood cells that show a faint blue or blue-orange color with right stain, a type of stain. Okay, normochromic, okay, means that the staining as we expected. Okay, hypochromic, they don't stain enough. Okay, they okay, and I am going to now show you here. Okay, this is okay. I should go back again. Okay, um, hypochromic, okay, and normochromic is about variation in colors. Okay, it has a meaning that I'm going to share with you just in a few minutes. Okay, the other parameter that we need to consider is alteration in erythrocyte size. Okay, alteration in color, alteration in erythrocyte size. This is also really important. Now, there are three definitions in terms of the erythrocyte size. Okay, and isocytosis, which means variation in size, as you see in these slides. Okay, there are different size of the erythrocyte in the same on the same slide. Okay, which we call anisocytosis. Okay, variation in the size. Okay, macrocytosis. Okay, if the erythrocyte is bigger than normal, as you see here, this is a normal erythrocyte, and these are bigger than normal, okay, we call microcytosis. Okay, anisocytosis is a general name about variation in size, but if they are bigger than normal, we call microcytosis. If they are smaller than normal, we call microcytosis. Now here you see microcytes here, okay, and microcytes. Smaller than normal, okay, bigger than normal. Now, anisocytosis, okay, variation in the size, okay. If they are smaller than normal, we call they call microcytic, okay, or microcytosis. And normal cytic, okay, is normal, and microcytic is bigger than normal. Okay, other test is estimate the platelet counts. Okay, platelet counts, which is related to clotting, okay, clotting cells. Normally, okay, 6 to 20 platelets per oil immersion field represent a normal platelet counts of 150 to 450 time 10 to 9 per liters. This is a normal count of the platelets. If they are below 6, the number that you report, okay, platelets, below the 6, you are going to report as decreased platelets. If they above 20, you are going to report the platelet count as increased. Okay. Okay, performing differential count of white blood cells, as I mentioned before, you are going to count minimum 100 white blood cells and then calculate the percentage of each types. Okay. Now, this video may be helpful.
Now we're ready to count the white blood cells on the microscope. First, place your hemocytometer, take it carefully out of your moisture chamber and place it on the stage of your microscope. The microscope stage should be all the way down and the condenser up. Then adjust your stage so that that spot of light is right about there on the hemocytometer. That's where your rulings will be showing up. Then you're going to raise the stage so it's about this far. You should have your 10x objective in place and raise it till it's just about this close to your 10x objective. Don't bring it up too far. You may break your cover slip. Now at this point you'll lower your condenser and then close the iris diaphragm. Now lean over the microscope. Looking through the microscope, you're going to lower the stage away from your objective with the coarse focus knob until the rulings come into focus. Then you'll focus on put the first square that you're going to count in the center. For your white cell counts, you'll focus on the square that is designated in your lab manual. and then find focus until our cells come into focus. Then as you count the cells, you'll keep track of them on a hand tally like this. And you probably need to find focus as you count. They'll show up as dark or bright little spots in the hemocytometer. And as you find each cell, just click it on the hand tally like this. After completing the count on each side of the hemocytometer, make sure you note your results on a lab report form. That concludes the demonstration of the manual white cell count.
Yeah. Okay. 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 All white blood cells in the circulating blood should be measured. Okay. You have to be patient. Okay, and be careful whether there are non-major white blood cell in the blood circulation, okay, which tell us something else to you. Okay, now the clinical significance of erythrocyte alteration is need to be discussed here because alteration in erythrocyte morphology are associated with many diseases, especially with anemia. Okay, anemia, either low level of hemoglobin or low level of erythrocytes. Okay, and anemia is not as specific as single disease. Okay, anemia is associated with uh, uh, is a condition in which there is a decrease in oxygenation of the tissue or organs. Okay, it has many causes, and the type of anemia and its underlying cause must be determined before treatment can be effectively undertaken. Okay, as I told you, okay, the alteration in size, the alteration in color, okay, tell us about the causes of anemia, okay? And this is really important because it has many causes, and the type of anemia and its underlying causes is important before you start with treatments, okay? If you have, let's see, microcytic anemia, okay, you see that the erythrocyte bigger than normal, okay, and the causes of microcytic anemia is totally differ from the microcytic anemia, okay. I'm going to show you some of them. Now, as you see here, the type of anemias, okay, in terms of alteration in color, variation in size, as you see here, the morphologic classification of anemia, normochromic, normocytic. What does means? Normochromic is color normally as expected, okay, is stain, it take the stain normally, okay, and normocytic means it's in normal size, okay, in normal coloration and in normal size is non-normal chromic, normochromic, normocytic, okay, as we see in these first pictures, okay. This type of anemia, Okay, if the cells are normochromic and normocytic, but you have a anemia, the causes may be acute blood loss or uh, maybe pregnancy, because during the pregnancy, the need of the erythrocyte number is increases. Okay, it result in anemia. Also, acute blood loss, maybe you lost erythrocytes in a short time, and the body is not able to replace them. Okay, uh, and which result in anemia, but this anemia is normochromic and normocytic. The color is normal, okay, the size is normal, but the number of the erythrocytes is too low, okay? If you have microcytic anemia, okay, if your erythrocytes bigger than normal, we call microcytic, okay, the the cause of this anemia most probably will be deficiency of vitamin B12 or folate. Okay, you also have to differentiate either deficiency of vitamin B12 or folate. This is also important. But if you have microcytic anemia, okay, the causes most probably will be vitamin deficiency. Okay, if you uh, examine that you have hypochromic microcytic anemia. Okay, what does means hypochromic is not stained enough. Okay, it's take less stain. Okay, and microcytic means they are smaller than normal, as you see here. Okay, they smaller than normal. Okay, and the stain is the okay. Uh, the concentration of the staining level is too low, okay? Which means that the causes of such hypochromic microcytic anemia might be iron deficiency or chronic blood loss or chronic infectious disease. Okay, then you have to differentiate which is the cause of such anemia and then choose your treatment, okay, for such patients. Okay, normochromic normocytic anemia, as I said, uh, the um, the uh, color of the red blood cells is normal. They are normal in size, but the number of the red blood cells is too low, and most probably the cause of such type of anemia is acute blood loss. Okay, as I told you, microcytic anemia. Okay, and they are bigger than normal. Okay, and the causes of such anemia, uh, deficiency of vitamins. Hypochromic microcytic anemia, they are smaller than normal, okay, and the staining uh, is not strength, okay, uh, and the causes of such type of anemia may be iron deficiency related anemia, okay, or okay, chronic infection disease, okay. Uh, we have to differentiate and find out the underlying mechanism of anemia. Okay, leukocyte alterations. Okay, as I told you before, leukocytosis is a high number of the white blood cells. Leukopenia is a white blood cells count below the normal. Okay, uh, okay, and there are also a subtype of the leukopenia, such as or leukocytosis, such as neutrophilia, eosinophilia, basophilia, or basopenia, okay, and lymphocytosis or lymphopenia. If the number is too high, lymphocytosis is if the below the normal is lymphopenia. Okay, then we are going to finish our chapters with these two questions, and then I will see you tomorrow, okay? Now let's go ahead and then send your answers. The morphologic appearance of the red blood cells in anemia associated with iron deficiency caused by diet or chronic blood loss, okay? What is the morphologic appearance of red blood cells if you have a iron deficiency, which caused by diet or chronic blood loss? Okay, hypochromic microcytic is the correct answer. Okay, keep in mind, okay, iron deficiency means deficiency of hemoglobin. Deficiency hemoglobin means, okay, the size of the erythrocytes is smaller because you don't have enough hemoglobin to put in erythrocytes, okay? And if you stain the erythrocytes, the stain is taken by hemoglobin. If you don't have enough hemoglobin, that means they will be hypochromic, okay? Less staining than normal. Okay, the correct answer will be A, okay? But thank you. Okay, and then last one. Okay, what is an increased variation in size of erythrocytes on the blood film? Okay, anisocytosis, microcytosis, macrocytosis, poikilocytosis. Okay. Okay, increased variation in size is microcytosis. Okay. Increased variation, okay? A variation in size is known anisocytosis, variation in size. It can be either um, okay, bigger than normal or smaller than normal, okay? This is a common name for variation in size, anisocytosis. But a microcytosis means bigger than normal. Microcytosis, okay, smaller than normal, okay? Poikilocytosis is variation in the color, okay? Okay, it should be enough for today. Any
Wait, so
question
you said
before?
A or C?
Okay, the is C, okay? Because the question is increased variation, okay? If I ask you the variation in size, only variation in size, the answer will be an isocytosis, okay? Now I am going to ask you increased variation in size, then this will be microcytosis C. Okay? Okay. Any question before you leave meeting?